Hello, everybody. Dr. Ashley here, and welcome to the new normal of providing lectures to you guys. Today, we're going to talk about some important law topics in Course 7190. Just make sure to note that this presentation is going to be broken up into 4 different sections. That way, you can pause, rewind, give your mind a break, whatever you need to do just to make it through the content. When you have a chance, grab you some coffee, and let's get started. If you haven't done so already, make sure that you download the Law Topics worksheet from Canvas. This is going to be your assignment for the week that's going to be due Sunday, April 19th by 11:59 p.m. It's going to count as a quiz grade. It's also going to be a very good review for my content for your upcoming final exam. And then lastly, once you finish it for this course, you can add it to your Appy binder for a good reference for when you go on rotation. These are the objectives that we're going to cover during this lecture. Let's go on and dive into the content. First, we're going to discuss the laws and regulations pertaining to the personnel, operation standards, and records of a Class C pharmacy. Class C pharmacy is a synonymous way of saying institutional pharmacy. A Class C license can be issued to a pharmacy located in an inpatient facility, a pharmacy located in a hospice inpatient facility, or a pharmacy located in an ambulatory care surgical center. You'll find out real quick that the worksheet has a lot of blanks and spaces for you to jot down different types of numbers, days, times, things like that. So those are some important information to remember going forward through most of your law topics, and especially for this lecture. Class C pharmacy requirements for pharmacist services are based on the number of beds available in a facility. A facility with 101 beds or more shall be under the continuous on-site supervision of a pharmacist when the pharmacy department is open for services. A facility with 100 or fewer shall have the services of a pharmacist at least part-time or on a consulting basis, but the pharmacist must be on site at least once every 7 days. Sometimes you will see a hospital pharmacy have an outpatient pharmacy as well. In this case, if an institution operates on an outpatient pharmacy, there must be a pharmacist on site when the outpatient pharmacy is open. The outpatient pharmacy must also meet all Class A rules, which Class A means community pharmacy, including the pharmacy technician to pharmacist ratio. And in the community world, that ratio is 4:1. So a lot of times you will see this option where a hospital that has an inpatient pharmacy also carry an outpatient pharmacy and like an institutional teaching hospital. Just know it's basically a community pharmacy where patients can walk up, fill their prescriptions, and leave just as they would a traditional big box store like Brookshire's, H-E-B, Walgreens, CVS. In the Class C pharmacy world, a pharmacist must be accessible in all Class C pharmacies at all times. This service can be provided in multiple different ways. A lot of times it's a phone number list of the pharmacists that maybe work at that facility, with the main one being the pharmacist in charge of the PIC. It can also be accomplished through telephone services that are answered 24 hours a day through a toll-free number that the patients can call. Or it could be a paging service to where it's a toll-free number that can be paged out to a pharmacist, and at their discretion or when they have a chance, they can get back to the patient and answer the questions if needed. So talking about the pharmacist in charge, basically you can think of this as the head honcho of the pharmacy or over that pharmacy of that facility. And here are some more numbers because it matters on what kind of PIC that the facility needs. So in facilities with 101 beds or more, must have one full-time PIC or pharmacist in charge who can only be PIC for one such facility. This PIC may not serve as a PIC for any other Class A, which is a community pharmacy, or a Class B, which is a nuclear pharmacy. Facilities with 100 beds or fewer must have a PIC who may be employed under contract as a consultant and may be part-time. One pharmacist may be PIC of no more than 3 such facilities or 150 beds. A pharmacist may be the PIC of one facility with 101 beds or more and one facility with 100 beds or fewer, as long as the total number of beds do not exceed 150. As you can imagine, being head honcho of a Class C pharmacy can be a big deal and carry a lot of responsibility. So that's what we're going to talk about on this slide. First and foremost, the PIC is responsible for assuring the legal operation of the pharmacy occurs every day, that it operates within the rules and regulations established by the Texas State Board of Pharmacy. They're also responsible for providing the appropriate level of pharmaceutical care services, so making sure that their customer service and that the type of care that they provide is at utmost highest level it can be. Also making sure that the support staff for the pharmacy, that includes staff pharmacists, technicians, and anybody else that might be involved in the process and making sure that pharmacy operates, has the tools and resources available to them to help provide that high level of pharmaceutical care. The PIC is also responsible for ensuring drugs and or devices that are prepared and distributed are done so safely and accurately as prescribed. PICs are also responsible for participating in development of a formulary for the facility. A lot of times this can be done through a leadership or a committee for that hospital or institution, to where they can set aside time to talk about costs associated with drugs, which generics or brands are important to carry on the formulary, and which ones are best suited to take care of the patients that enter the facility. And then lastly, PICs are responsible for supervising a system to ensure maintenance of effective controls against prescription drug diversion occur. And a lot of times these are done or put in place to prevent the diversion and the loss of controlled substances, which we'll talk about later within this lecture. If you look within the hierarchy of any class of pharmacy, you'll notice that the pharmacist in charge is at the top of the pyramid, but closely, right underneath them, is the staff pharmacist. Now, a staff pharmacist is extremely important to the pharmacist in charge. Not only are they responsible for the delegated acts performed by pharmacy technicians and trainees, but they're there to help them ensure that the pharmacy is running and operating as it should under the rules and regulations set forth by the Texas State Board of Pharmacy. Now, a pharmacist in charge and a staff pharmacist can also be labeled as a distributing pharmacist. The distributing pharmacist is defined as the pharmacist who checks the medication prior to its distribution to a patient. As you can imagine, there's a lot that goes into this process. Includes drug regimen review, which looks at drug interactions or allergies to medications and so forth. Also verifies the data entry of the prescription to ensure that it was typed correctly for the right drug, the directions are correct, the drug is prepared correctly, its distribution is done so to the right patient, and the correct product is labeled. So there's a lot that goes into that. In the Class C pharmacy hierarchy, and right underneath the staff pharmacists, you will find the pharmacy technicians and the pharmacy technician trainees. The roles and responsibilities delegated to these employees is crucial to the operation of the pharmacy. Here's some more numbers that we need to take note of, okay? So here we go. In facilities with 101 plus beds, the following duties may be performed under physically present pharmacist supervision. So the pharmacist has to be on site at that pharmacy. So these technicians and trainees can prepare and package unit dose and multiple dose packages. They can prepare, package, compound, or label prescription drugs pursuant to medication orders. They can compound non-sterile pharmaceuticals after appropriate training. In some situations, they can compound sterile pharmaceutical products after appropriate training. Now, this can only be done in Class AS pharmacies. Bulk compounding or batch preparations can also be completed. Distributing routine orders to stock to patient care areas within the institution can be performed. They can also enter medication orders and drug distribution information into a computer system. These technicians and trainees can also load unlabeled drugs into an automated compounding or counting device. And lastly, they can access automated medication supply systems. In the next two slides, we're going to talk about facilities with 100 beds or less. Now remember, these facilities are not required to have continuous on-site pharmacist supervision. With that being said, the type of pharmacist supervision that they do have determines the duties that a technician or a trainee may perform. For purposes of this slide, the following duties may be performed under physically present pharmacist supervision. These technicians and trainees may be able to prepackage and label unit dose and multiple dose packages. They can bulk compound or batch prep. They are able to load unlabeled drugs into an automated compounding or drug dispensing system. They can compound low risk, medium risk, and high risk sterile preparations after appropriate training. And note, this can only be done within Class CS pharmacy only. They can prepare, package, and compound or label prescription drugs pursuant to a medication order. They can distribute routine orders for stock supplies to patient care areas. They are able to enter medication orders and drug distribution information into a computer system. They are able to access automated supply system, and they are also able to compound non-sterile preparations. The other type of pharmacist supervision available in facilities with 100 beds or less is electronic supervision of a pharmacist. As you can immediately see, the duties list dwindles quite a bit. These technicians and trainees are actually able to prepare, package, compound, or label prescription drugs pursuant to medication records. They are able to distribute routine orders from stock supplies to patient care areas. They can enter medication orders and drug distribution information into a computer system. They are able to access automated supply systems. They can compound non-sterile preparations. And lastly, they can compound low-risk sterile preparations after appropriate training if the pharmacy is deemed a Class CS pharmacy. When speaking to the pharmacist-technician ratio in Class C pharmacies across Texas, know that there's not one. In other words, there's not a limit to the amount of certified pharmacy technicians or trainees that may work under one supervising pharmacist. A perk to Class C pharmacy in Texas is a tech opportunity. Try saying that 3 times real fast, it's pretty hard. Anyways, this is an opportunity that a Class C pharmacy may have if it has an ongoing clinical pharmacy program that may allow a technician who is not a technician trainee to verify the work of another technician who is not a technician trainee relating to the filling of medication carts, distributing stock supplies to patient care areas, and accessing and restocking automatic medication supply systems like a Pyxis machine or something like that. We're going to switch gears a little bit and talk about rural hospitals. Of course, they're defined by numbers that you'll need to jot down on your worksheet, but they're defined as having less than or equal to 75 beds and located in a county with a population fewer than 50,000, or designated as a critical care access hospital, rural referral center, or a sole community hospital. Especially in East Texas, these are going to be a lot of places, especially in counties that might have a lot of small towns joined together. If a practitioner orders a prescription drug or device for a patient in a rural hospital and the pharmacist is not on duty or when the pharmacy is closed, a nurse or a practitioner may actually withdraw the medication from the pharmacy in sufficient quantity to fulfill an order. The important caveat to know here is that just because that does happen, a hospital pharmacist still needs to verify the work, and they have to verify the withdrawal and perform a drug regimen review no later than 7 days after the withdrawal. In a rural hospital, pharmacy technicians, and note, we're not talking about technician trainees here, but we're actually talking about certified pharmacy technicians. They may perform the following duties without direct supervision of a pharmacist. They can enter medication orders and drug distribution information into a computer system. They can prepare, package, or label prescription drugs pursuant to a medication order if a licensed nurse practitioner or pharmacist verifies the accuracy by electronic supervision before the medication is administered to the patient. They can fill medication carts used in the rural hospital. They may distribute routine orders for stock supplies to patient care areas. And lastly, they can access and restock automated medication supply cabinets if needed. Because these technicians don't have direct supervision of a pharmacist, it's really important to note that a nurse or practitioner at the hospital or a pharmacist through electronic supervision must verify the accuracy of the pharmacy technician performing the duties listed above. If you think about it, Class C pharmacies are located in hospitals who pretty much provide 24 hours a day care. And sometimes, depending on the pharmacy, it may be closed. So the next few slides, we're going to talk about what to do in the pharmacist's absence. So in facilities with a full-time pharmacist, when the pharmacy is closed, a designated licensed nurse or practitioner may remove drugs for the patient's immediate therapeutic needs. If that does happen, a record of the withdrawal must be made containing the following: name of the patient, name, strength, and dosage form of the drug or device, the dose prescribed, quantity taken, time and date, and the signature of whoever took the medication. With that being said, note a pharmacist must verify withdrawal as soon as possible, but no more than 72 hours after the withdrawal. In facilities with a part-time pharmacist or consultant pharmacist when the pharmacy is closed, a designated licensed nurse or practitioner may remove drugs and devices for the patient's immediate therapeutic needs. For the withdrawal, the same recorded information as previously mentioned on the slide before is required to be documented. This includes the name of the patient, name, strength, and dosage form of the drug, dose prescribed, quantity taken, time and date taken, and the signature of whoever made the withdrawal. A pharmacist shall verify the withdrawal of the drug from the pharmacy after a reasonable interval, but in no event may the interval exceed 7 days. So remember that for your worksheet. If you are using a floor stock system of distribution in your facility, the same rules apply, and the pharmacist must verify withdrawal no more than 7 days after that withdrawal. Class C pharmacies across Texas are required to provide the following resources: The first basically being the Texas Law Book. A lot of the information for the acts and rules listed are found from the Texas State Board of Pharmacy website. The second being a drug interaction reference. Third, general drug information reference. Fourth, an injectable drug product reference. The fifth being a basic antidote information and phone number of the nearest poison control center. I just want to give you all a heads up, that phone number was actually on my board exam, so I know that number still by heart to this day. And then lastly, a metric apothecary weight and measure conversion chart. It doesn't matter if these are in print, they can be print or electronic. It just needs to be available to the pharmacist and the support staff that are working within that pharmacy. Some other Class C operational standards to take note of is that a formulary is required. As we mentioned earlier in the presentation, the PIC is responsible for helping the institution maintain that formulary. Also note that prepackaging of drugs is allowed for distribution under the facility or for distribution to other Class C pharmacies under common ownership. It just has to have some type of record-keeping requirements that must be met and approved by the State Board of Pharmacy. Also, written policies and procedures of a drug distribution system are required. Floor stock records must be reviewed by a pharmacist at least every 30 days. And lastly, a perpetual inventory of C2 drugs is required. It's not optional in Class C pharmacy in Texas. It must be done. Lastly, and more numbers and times to jot down on your worksheet, a drug regimen review must be conducted on a prospective basis when a pharmacist is on duty and a retrospective basis when a pharmacist is not on duty. Retrospective review must be conducted within 72 hours if the hospital has a full-time pharmacist, and if the hospital has a part-time pharmacist, the drug regimen review must be conducted within 96 hours if the facility has an average daily census above 10, and within 7 days if the facility has an average daily census of 10 or fewer. I know, there's a lot of numbers there. It turns into number soup real quick. Let's spend a few seconds and talk about emergency rooms. When a pharmacist is on duty in the facility, any drugs dispensed for outpatient use, including to emergency room patients, must be dispensed by a pharmacist. When a pharmacist is not on duty, dangerous drugs and controlled substances may be supplied to patients admitted to the emergency room under the following conditions. Only drugs dispensed on an emergency room drug list may be provided. Drugs are supplied in prepackaged quantities not to exceed a 72-hour day supply. And lastly, drugs are prepackaged by the pharmacy department, and at the time of delivery, the label is completed by the practitioner or nurse with the following: name, address, and telephone number of the facility, date supplied, name of the practitioner, name of the patient, directions for use, the unique identification number, which a lot of times is also known as a prescription number, the brand or generic name and strength of the drug, and the quantity supplied. Pharmacists shall verify the contents of the emergency room drug list records at least once every 7 days. Because it's the year 2020 and technology is trying to rule the world these days, the same is pretty much true in the profession of pharmacy. As you can imagine, in Class C pharmacies, institutions, and hospitals, there's technology everywhere. There's 3 main types of automated devices and systems that you will see in Class C pharmacy. First being the automated compounding or counting devices. Second being automated medication supply systems, and lastly, automated checking devices. First, we're going to talk about, or just mention briefly about, the automated compounding or counting devices. As you can see in the pictures, there are different types. The first one that you see on the top left is actually a TPN maker. So you can see it has different bags of fluids and different types of additions to add to a TPN that measures them correctly based on what is inputted by the technician or the pharmacist. And then down below, you can see a Parata machine that actually counts medications based on what's ordered through a computer system and basically takes the counting by fives out of the equation altogether. As you can imagine, these devices and systems must be calibrated and tested for accuracy pretty often. A lot of times, different institutions has that set based on their operating procedures. More often better than not, just because they want to ensure that the accuracy of what's being dispensed or administered to the patient is correct. And these actually can be loaded by a technician, but before anything is put in the machines, it has to be verified by a pharmacy prior to use, or a pharmacist prior to use. The next type of device that we're going to talk about is the automated medication supply system. A lot of times these are given the nickname of Pyxis machine. Pyxis is a brand form of these machines, but a lot of times they just kind of get thrown in that one name. As you can see from the picture, each machine is given a computer, that's tied into the medication record keeping system for that facility. The nurse can actually look up a patient based on their medication profile and pull prepackaged drugs from that machine based on when that order may be due for a patient. As you can imagine, these are tested and verified for accuracy and are required for continuous monitoring, and basically those accuracy tests need to happen at least every 6 months, or if there's an upgrade or a change to the system. They have to have specific operating procedures to use these machines. A lot of times nurses and other support staff that may be pulling medication from these machines must have guidelines to use where they just can't go in and get medication when a patient may not need it, or they're trying to get medication for another patient even though it might not be time to be given. So there has to be basically policies and procedures set in place to prevent that from happening. And lastly, technicians may be the ones to restock these machines. A lot of times before a patient goes up to the floor to put the medication to replenish these, those restocking drugs and whatnot that goes in the machines must be verified by a pharmacist to ensure that it is the right medication, they're going in the right slots, and that when a nurse pulls the drug based on what the computer reads, they're getting the right thing. The last bit of technology that we're going to talk about are automated checking devices. These critters are a fully automated device which confirms after a drug is prepared for distribution but prior to delivery to the patient that the correct drug and strength have been labeled with the correct label for the patient. So it takes the person out of the equation altogether almost. The accuracy is pretty good on these things. I don't know the percent offhand, but it takes the human error out of the equation altogether. Across all classes of pharmacy in Texas, there are records, and the Texas State Board of Pharmacy has different tidbits and timeframes that apply to those records. So firstly, you want to keep your records for Class C pharmacies for at least 2 years, and they must be supplied to the State Board within 72 hours upon any request. C2 records must be maintained separately from all other records. C3 through C5 records, which are controlled substances Scheduled 3 and 5, must be maintained separately or be readily retrievable. And that readily retrievable can be in quotation marks, and we'll talk about that as we get to the controlled substance part of the lecture later. Outpatient pharmacy records must be maintained under Class A pharmacy rules, a lot of times 2 years. Patient medication records must be maintained for each patient. So if you have a family that comes in at the same time, you can't combine files. You have to have a different medication profile for each patient. And then lastly, a computer system must be able to produce a hard copy printout of an audit trail of all drugs dispensed in the facility, including specific information such as the patient's name and room number or ID number, the prescribing physician, drug name, strength, and dosage form, and the quantity dispensed. And with this being said, the computer must produce any audit trail request within 72 hours from the state board initially requesting it. Well, we finally made it to the last slide in part 1, and who needs a refill on that coffee? Am I right? Anyways, there's 2 other tidbits that I want you guys to take away in regards to Class C pharmacies in Texas, is that there's a couple of license types for Class C pharmacies. The first one being a Class CS license, and these are obtained by Class C pharmacies that are engaged in compounding sterile preps. These licenses are not issued until the State Board of Pharmacy does an audit to ensure that everything is kosher, and then they will be authorized upon that point. But you're not allowed to engage in any type of sterile compounding until you have that license. And then the second type of license is a Class C ASC license, and a lot of times these are granted by the State Board of Pharmacy to freestanding ambulatory surgical care centers that have a pharmacy within their location. That's it. So take some time, go through the first part of your worksheet, fill in those blanks, and get ready for part 2.